So hello everybody, this is Liz Lobeo. I'm a member of the ICANotes training team, and we're having a lunch and learn today, and I will be conducting this for you. So I set up a new chart for a patient, Ann Ballers, and she currently does not have a treatment plan set up. I don't have an active problem list of issues that she's dealing with. I'm going to come over here and click into the treatment plan tab. Now, right now, by default, it's showing our old treatment plan, but this Friday night we'll be updating it. And when you log in over the weekend, you'll see our new general 2.0 treating plan. If you've worked in our treating plan in the past, you're going to find the workflow similar but more streamlined, and we're going to be able to move in just a direct left to right workflow. You're not going to have to move backwards in terms of entering data at the end. On the first tab that we're on here is the list of active problems. Right now, I don't have any current active problems for this patient, so there's no current active problems for me to update. If I want to add a new problem, I just click this button right here. And it takes me over to the next tab, which is the problem manifestation detail. And I want to point out to everybody that before we had about 21 different psychiatric problems and about 30 different nursing problems. The psychiatric problems are anxiety, depression, substance abuse. The usual suspects are in here. Nursing problems, on the other hand, are really medical problems, and we've enhanced and enlarged this list for you. We also have a list of social problems, economic, family, health, nutrition, and what have you. We have one option here under rehab. I'm going to come back to the psychiatric problem. It doesn't matter if I'm logged in as a nurse or a doctor or a therapist. I can go right into the psychiatric problems or issues and choose one. I'd like to pause just for a second and say that with this updated version of the program, we have the ability to add in more problems to this list. If you're looking for a problem and we currently don't have it, if you can provide us with the problem, some long-term goals and specific short-term goals that would go with that problem, maybe some interventions, we can quickly add those into the program for you. Additionally, if you're working in this version of the program and you come onto the psychiatric problems and there's just problems here that you never see in your setting, and you don't want them, you don't use restraints, you want this to disappear, we can make particular buttons disappear for you guys now pretty quickly. So we have a way of kind of customizing this for your workflow as we move forward. All right, so I'm coming in here, I'm working in the treatment plan for Ann Ballers. Her date of birth, the program tells us she's 49 years old, and here's her ID number. I'm going to come in here and pick a psychiatric problem, and I'm going to pick up, first of all, I'm going to say that she has a depressed mood. And it's going to display manifestations. And if you're familiar with our program in the past, we've added additional manifestations here for her problem. I'm going to come down here and click that she's having thoughts of death or suicide or self-injury. And I can detail that. And I'm going to say that she's experiencing these almost daily. So here's your first identified problem. I'm going to come down here to, come over here to the long-term goal, and your problem list is on the left side now on each page of this new treatment plan, so you can always refresh your memory. We want to pick one long-term goal in ICANotes. You only use one long-term goal. We will pick multiple short-term goals. The idea behind this is when the patient's met multiple short-term goals, and then they've met their one long-term goal, you'll be able to defer the problem. So let's come over here and pick a long-term goal for this patient. And I'm going to say she will learn to cope with feelings of depression. So we're not expecting her to be totally depression-free, but we would like her to have the ability to recognize, accept, and cope with feelings of depression. And I'm going to put a target date down as 1 month from today. I realize it might be very different in your particular settings. It's going to come down here to August 26th. It might be 10 days or it might be 3 months, depending on whether you're working in an inpatient or an outpatient setting. You do need to click the Set button to show the target date right here. Please pay attention that on each tab of the program, we do have custom buttons. So if you're looking for a long-term goal that we don't have, you can build one over here and just drop it into the program and put your own target date. Let's come over here to the short-term goals. And I like to think of the short-term goals as behaviors for the patient that you want to modify in the short term relative to the manifestation, which is thoughts of death, suicide, or self-injury. And you can see that the program has given you options automatically. So I want this patient to, right off the bat, start doing a couple of things. I want her to report thoughts of death or suicide to staff. And there's a couple of options that we have down here. How often do I want her to do this? I want her to start doing this, I could say either immediately or as soon as these occur. And for my target date, I'm going to put down today's date. I want her to start doing this immediately. I can always type in additional information. The patient understands this short-term goal and agrees to go with it. I'm not going to put down a completion date till this has been met. For progress, I'm going to say right now she's working on it. We'll leave the status alone until this short-term problem has been resolved. If you make a mistake and you put in a short-term problem or a goal, you can just click the little trash can icon and this will go away. I'm going to come over here and add a second short-term goal. I want the patient to, let me see here, develop a crisis plan. And I want her to do this, I'm just going to give her a target date. I'm going to give her till Saturday, the 30th, to do that. And I'm going to say that she's working on this right now. Now, if you had custom buttons here, you could click custom buttons and put an additional short-term goal. Also, if you wanted to free text a short-term goal in here, we've added a new button called Add a Blank Short-Term Goal. You would just click here, and it says, would you like to add a new short-term goal to this problem? And I'm going to say yes. And you can add your own goal right here by typing, okay? And then you could put down a target date. I'm just going to put the end of the week for this one and say that this is a work in progress. Let's come over here and go forward and move into interventions. Now, when you're working in the program, just like before, you can use this as a single clinician, like maybe you're just a nurse or you're adding information in as just a therapist. Today I'm going to say I'm a therapist. But we do have the ability to turn you into a scribe and to put interventions in for all members of your team. I'm going to play like I'm a therapist right now, and I'm going to just start at the top and work my way down. So manifestations, what's going on here? We want to enter manifestations that are linked to short-term goals, thoughts of death or suicide or self-injury, and the goal is we want her to report her thoughts of death. When I click on this, as a therapist, the top button on this drop-down list should be specific to the therapeutic intervention for this short-term goal rather than, say, the nursing intervention. So let's click here and see what it says under our selected interventions. And it does say therapist or counselor, just like we have up here, will require Ann to report thoughts of death, suicide, or self-harm to staff. Progress will be monitored and documented. These areas are optional down here. You could say that you're going to be doing this daily with her or for a period of time. And I'm just going to put down my LCSW, as, for example. Or you could put down the initials of the social worker or therapist that's doing this if you're logged in as a nurse. I'm going to continue on with therapeutic interventions. She's manifesting thoughts of death or self-injury. And we want her to develop a crisis plan. Once again, the first choice on the list is what we're looking for. Therapist or counselor will help and encourage Ann to develop and describe a crisis plan. It includes support to call, how to utilize coping skills when suicidal or self-harm is going on. And we want her to start working on that daily, and we're going to give her, let's see here. I'm just going to put down that this is by the LCSW as well. And finally, on our third one, we want her to, let me see, it says, oh, this was that custom button. So if I wanted to put something in here, I can either make a custom button relative to the manifestation that I had created before under the short-term goal, or for a little workaround sheet, I can come over here and click something here. If I don't like what that says, I can erase it, and I can add my content by free texting. If you do make a spelling error, you can right-click on it, click Learn, and we'll go forward from there. If you wanted to go ahead and add a nursing intervention for the nurse on your team, if you were acting as the scribe, you can click here under Nursing, and you can come up here to Thoughts of Death or Suicide as viewed from the nurse's standpoint, and the nurse would maybe start providing nursing education or medication information. It says nurse will provide and with medication education to monitor her compliance when prescribed medication for relief of depressive symptoms. And I can click outside of this field, and I can give the RN credit for putting in this particular manifestation. You could do the same thing for the psychiatrist or the case manager. Let's go forward here and look at plan strengths. This works exactly the same way as it did for our prior program. I'm going to say that her family is her strength. She has the ability to use strong family ties. She's got family support. She's got good relationships with her family. You can put in more than one. Maybe she's also has sustaining spiritual beliefs, and I can pop that in here as well. You can click the undo button if you want to erase this and start over. We're going to move to the right and go over here to barriers. And I'm going to say that motivation is a problem for her. I click this button, come down here and click the fourth option. Therapy will focus on motivational problems first. And when I click the set button, that barrier will be displayed right here. I've also made a custom button about emotional issues interfering with her treatment. I'm going to click that in here. It says emotional problems interfere with treatment. Emotional problems will be dealt with via, I have group, but I can put down group/individual therapy, and click outside this field here. I could have also clicked into the edit area and updated this button so it would read like this when I click this moving forward. Let's go forward into the status. Once again over here, your problem is being displayed. Notice that it says here sections 1 and sections 2 are for follow-up plans only. This is the initial plan, so we don't need to go in here into number 1 or to number 2. We have the option to go into sections 3 and sections 4. We do have custom buttons over here that you can build specific to your status text for your setting. I'm going to enter a new status text with a particular date and come over here to number 3. We have different types of disclaimers. My favorite one to use is the face-to-face, and it puts down the date, the undersigned clinician or clinicians. If you're working as a scribe, you could put an S on the end of that. Met with the patient and family as appropriate. If family wasn't participating, I just come over here and erase this. On the date above in a face-to-face meeting to work with him or her in developing this treatment plan. The other options that we have here sound more psychiatrist, psychiatrically centric. So as a non-prescriber or as a nurse, I tend to use this option. I'll just give you a peek at what they say. The licensed professional who signs the service agreement has reviewed the individual's clinical assessment. We have one for medical necessity. My signature confirms that this is a medically necessary admission or treatment plan. And then we have one for a patient that's on multiple antipsychotics that I'll leave alone for right now. Under the status area, we have some additional fields that you can go into. We do have a SNAP scale. I'm going to run you through this really quickly. If you're not familiar with the SNAP scale, we'll click on it here. It's a short shrub, and the program actually tells you that Anna Ballers has identified the following strengths, needs, abilities, and preferences, as well as goals and desired accomplishments. This information will be used in the development of the patient's personal achievement agenda, and this is the key phrase right here. So in other words, you're putting into the treatment plan information that she's telling you individually as being a strength or a need that she has, and this will help to individualize her treatment plan. I'm going to come down here and just work my way down. I'm going to say I'm the patient, and I'm going to say to you guys, you're my therapist. My strengths are that, let me see here, I come from a stable environment, and I have sustaining spiritual beliefs. What needs do I have? Maybe I would like somebody to explain my diagnosis in more detail. Maybe I need help with, for example, parenting skills or substance abuse. And if I have personal needs, I can come down here, and we have a nice list here. I have a lack of community support, and maybe I tend to avoid self-disclosures. Abilities that I have that I want to take credit for, I can accept criticism. I'm willing to participate fully in the program. You can put down treatment preferences that the patient has. This patient says they're interested in educational classes and individual therapy. If there are specific issues, feel free to document that. Depression, anxiety, if there's a medical problem, you could go here. What are the patient's goals relative to that? They maybe want to get back to work or continue with school. And you can come down here and put a desired outcome. I'm going to say perhaps learn how to manage my feelings better, improve my overall health, relapse prevention, or whatever else you need to. All right, I'm going to go back. The BPRS-18 scale is specific for patients. This is more of an inpatient workflow for patients that are having thought disorders and psychotic features such as conceptual disorganization, mannerisms and posturing, hostility, suspiciousness. I'm going to skip this right now. You do have the ability to self-score this BPR-18 rating scale if you choose to put it into your treatment plan. The third and final area that we have, it's a PRN area. You can talk about the expected length of stay, continuity of care, and transition planning. You don't have to go into all of these. You can choose just the areas that make sense for you. We get a window here where you can do your work. If you know the expected length of stay and you want to document that in the treatment plan, I'm going to come down here and say, for example, this patient's going to be in for approximately 2 weeks. If I want to mark the date, they have to come over here to August and say August the 3rd. If I want to put down who's on my staff, who is the, whoops, come over here. Who's on my staff who is the therapist, the primary therapist, I'm going to say that it's, let me see here. I'll just say dispenser, for example. Excuse me, please. And who's the primary psychiatrist? And I'm going to come down here and say that it is Courtney Kimmel, MD. Okay. If I want to talk about discharge planning after discharge, or if I want to talk about transition to discharge, we have shrub areas that you can go into and use our custom buttons. Since this is the initial treatment plan, I'm just going to put down for right now to be arranged, maybe in the next treatment plan, and move forward. And now this information is showing under your text status. I'm just going to highlight your transition plan here so that you guys can see it easily. We'll scroll down so that you can get a nice look at everything that's been captured in here, including your SNAP scale, and the fact that your treatment planning has been deferred for a future note. Once again, you can use custom buttons if you want to add additional information. We're going to come over to the last tab where we can compile this note. We've added a button right here. If you want to add a second problem, you can just click here and add a second problem and work right across here again. I'm going to go ahead and do that and put in a medical problem. If I didn't want to add a second problem, I could just preview the problem for depressed mood right here and compile the note. But let's come back and add in a problem for a medical problem really quickly. We're going to add our new problem, and I'm going to come over here, and instead of going into a psychiatric problem, I'm going to choose a nursing problem. And let's come down here and say the patient's diabetic and has unstable blood sugar levels with an elevated fasting glucose and elevated hemoglobin A1C level. I can come down here and come up with a long-term goal, and we want to, let's say, normalize the patient's blood glucose level during this admission. And we're hoping to do that for a long-term goal. I'm going to say within a week. as my long-term goal, my target date. Once again, I'm going to move over here to the short-term goal. I have different prompts that I can use. We're going to be attending diabetic information classes, for example. I'm just going to put down 1. And how frequency will she be doing this? And I'm going to say 1 to 3 times per week. And these are going to be for 20-minute sessions. And the target date, I want her to start doing this by this Friday. And we can come back and update the status of it later. Once again, you can add a new blank area if you need to free text. You can always make a custom button and use custom buttons here. I'm going to move forward into interventions, and I'm using a nursing intervention right now. So when I click this unstable blood sugar level, the first option should prompt me to a nursing intervention that would make sense to that, relative to that short-term goal. And it does. Nurse will instruct and have Anne repeat basic information about diabetes, including dietary medication, need for follow-up medical care. Progress will be monitored and documented. Once again, you can always add more information to further individualize this note. Now, I've moved over here to strengths. The program has remembered the strengths from the last problem. The program's remembered the barriers. I'm not going to update these now because they certainly haven't changed in the last 2 minutes. When I come over here to the status area, we're still working in that initial note. We don't have to do sections 1 or 2. If I want to do any kind of update for this particular problem status, I can come over here and just say, once again, we did meet with her in a face-to-face meeting. I'm not going to go through these areas because I've already captured that in the prior problem. Let's come over here to compile this plan. Now, once again, I can come back and add a 3rd problem, work my way across, come back and add a 4th problem. So add as many problems as you want to when you first get into this. I am going to put down here when this was last done, which was today's date. And if I want to set up a clinical reminder to send me a message in the chart room in the messaging center when I would like to update this treatment plan, this is where I set the dates up. And I'm going to come down here, and it defaults out to 3 months. We have now added 2 problems. You can come over here and set up the beginning of this master treatment plan. So this meeting was on 7/27/2016. I can put down the start time. Maybe we started this at 11 o'clock, and it went just for 15 minutes to 11:15. I can call this the initial treatment plan, or a 48 follow-up, or a 3-day follow-up, or I can click over here to other and put down another title if I prefer to. I can add the members that participated in this particular session by clicking on names right here. And I'm going to say Alyssa was in this session and she was the activity therapist. And I'm going to come down here and say Joy Demo was in here and she was the, let's just say the psychiatrist. And I'm going to add one more name here, maybe Liz was the therapist. And I can also add the patient's name here just by texting in the patient's name. So Ann Bowers. And I can come down here and put down that she is the patient. To click out of here and type in patient. Okay. So who was present in this meeting today? All 4 of these people were present. Now that information is going to be put into your note when we compile it. I'm going to come down here and preview the comprehensive treatment plan for all problems, all strengths, and all barriers. I do want to include the diagnosis. Let's click here. And you can see the information is displaying right here. I'm just going to put a little break in here so you can read it a little bit more easily. We have 2 problems identified. Diabetes. Just teasing this out a little bit so you can read it a little bit more easier. Here's the status area. Then we have our depressed mood showing next. The short-term goals and interventions. The long-term goal at the top. And then the status, and you can see who took credit for each one of these meetings, or each one of these interventions, rather. Here, this one's by the social worker. Here's that free text field that we had put in. Here's the status here. If you have a little bit of a gap, you can always do something like this to cut it out. Here's my SNAP scale. And then we've left an area down here at the bottom if for some reason you want to print this out and gather signatures that way. I'm going to go ahead and save this as a progress note. Here we go. The program has said to me, do you want to set up, you have set up a treatment plan. Would you like to set up a clinical reminder? I'm going to say, yes, I do. Just to walk you through this, anybody that's not familiar with this, you want to be prompted. We'll see if we can change the date from this field. This is a clinical reminder. I'm sending from myself to myself. I can just send it to other members of the team. Let's see if it'll let me come back here and send this in August. There we go. This is not a recurring event. Notice here that the subject line has already been filled out for you. I'm just going to send myself a message. Update short-term goals, PRN is linked to the patient. We have some custom buttons that you can create to build content in here for your message, or excuse me, for your subject line rather, for your subject line. I'm going to save this. This is now pending. You don't have to do anything with this. On 8/10/2016, this will be delivered to your inbox. I'm just going to go back to my work area. You now have a reminder set up. Now, this is the initial or master treatment plan for Ann Ballers, and it says treatment plan here. If you would like to, and I like to do this, if I want to individualize this and sort out standard or subsequent treatment plans from a master treatment plan, remember you can always come over here to change the note title. And I have a whole bunch of custom buttons that I've made so I can change the title at the top, and I have different ways to sign this particular note. Now I could come over here and click Other, and it says Treatment Plan, and I could put down, so I could put down Master Treatment Plan and click OK, and it would update. Likewise, I've made a custom button that would do the same thing over here. I set this up for a nurse doing intake. Let's go back to my master treatment plan, initial treatment plan. Okay, so this just says initial treatment plan. If I'm doing this as the LCSW, I could have my name Liz Lobeo, RN if I was doing this as the nurse. Or I could come over here and say I'm the counselor, for example, doing this, and click continue. So we're in your master treatment plan right now. You can see what time it was started and stopped. You can see who the participants are. We have a diagnosis. The program is pushed forward. The current medications that the patient's on. Your problem list has been identified here. The problem for diabetes is showing first, with the long-term goals and the short-term goals and the status associated with that problem. The second problem for depressed mood is displaying next, with the long-term goal, the target date, the short-term goals. The interventions, and you can see who set up the interventions right here for each of those short-term goals. The status for this particular problem shows below, and remember, this is the first one we did, and it went in, and we had gone in and done the SNAP scale as well. Just make this in bold so you can see it a little bit more easily. Our transition plan is showing. At the very bottom of this, the plan barriers and the strengths are showing right here. Now this is designed, I think this is more for an inpatient setting where you're want to print this out on paper and pass it around and have everybody sign it and then scan it right in. If you're not going to be using this workflow, you can erase everything and just electronically sign it, or you can erase a portion of it, like I'm going to do right here. Maybe if this treatment plan, a copy was given to the patient, a copy of this plan was, let me see, given to the patient. Though my family didn't decline it, so I'm just going to say it was given to the patient. And then I'm actually going to take this out down here because I'm going to electronically sign this. Let's take a look and see what that looks like. And we have a nice electronic signature. Initial treatment plan. I'm going to go back to the chart base. Here's your initial treatment plan done on 7/27/2016. It's been electronically signed. Now moving forward, let's say you get a notation, let's pretend like it's 3 or 4 days later, and you want to update this treatment plan. So the workflow is not to go back into the old treatment plan, wrong workflow. You want to come up here and you want to click this button, and you'll be able to get right into our new treatment plan 2.0. And now on this page, you can either select a problem that's already displayed and click on it to update it, one or both of them, or you could leave them as is and just come in and add a new problem, or you could do all three or any combination of the three. What I'm going to do right now is update the issue with depressed mood, okay? So let's just stop here for a minute and talk about what's going on over here. Let's say her diabetes resolves and her glucose has dropped back to normal and she's finished her education class and she's doing well on her diet. If you had put down under her diabetic problem that she had met her long-term goals for diabetes and met her, her short-term goals for diabetes and her long-term goals, you could then come in here and put an X right here. X indicates an inactive problem that will not be included in the new treatment plan. So that's how you inactivate a problem in the program once the short-term and the long-term goals have been resolved. You do not put it in the trash can. You want to leave it here. A line will display later on telling you that it was a problem. She's now taking care of it. Now, for our purposes today, this patient has not met her goals for diabetes, so we're going to leave this as an open problem. I'm going to come down here and go into her depressed mood, and we're taking into the problem identification. I'm not going to change anything here. She has not met her long-term goal yet, so I'm not going to change anything here. Generally speaking, I want to come in here and update her short-term goals and possibly her interventions. So I can come down here with the short-term goals that I had set up. I can now come down here and say, well, what kind of progress is she making? So let's say she's no longer suicidal, and I want to say, you know, we can opt out of this problem. She's not acutely suicidal. So I'm going to say the completion date, and I'm just going to put down today's date. And I'm going to say that this is I'm going to go over here. Whoops, I'm going to go, oopsie. I'm going to go over here to the status, and I'm going to say that this has been effective. So I can say whether this intervention was effective or intervention. She's still working on a crisis plan. That's not due until the 30th. If I want to give her additional days to do that, maybe she says, hey, can I have until Monday or Tuesday? You could definitely update this. You can say she's working on it, or it's partially, or she plans to start sooner. Gosh, she's almost done. And we'll save the status until she's finished with it. You could do the same thing. You could update your goal right here. I could come over here, and if I want to add a new short-term goal, I'm going to pick a manifestation now that I've updated the current short-term goals. And I'm going to say, let me see here. She will express no suicidal ideas for at least, I'm going to come over here to the for field, for at least 3 days. And I'm going to give her a week to get there and say that this is currently, and she's working on this right now. Okay. Let's come over here to interventions. And I'm working in here as a nurse, but if I want to address want to look at therapist interventions, I can come over here. And these are the interventions that we had set up before. I want to talk about her new intervention for expressing no suicidal ideas. When I click here, the first button choice is going to be specific to the therapist and this short-term goal. She will be free of death, suicide, or self-harm feelings. Counselor will provide therapy to support, encourage, and to be free of thoughts of death, suicide, or self-harm for at least And I could come down here and say, about 75% of the time. And I'm just going to put down my initials as the LCSW and move forward. I'm not going to update any strengths or any barriers today. Of course, you could if you needed to. We're going to go into the status area, and for the updated note, workflow is a little bit different than it was before. I'm just going to close up some of these areas here. So it used to be that you had to erase the status text, but now we have a button down here where you can update the status. So you have a running commentary of what's going on. For our new entry date of today, I do need to do sections 1 and 2 and sections 3, possibly sections 4. I'm going to say, what progress has she met in meeting these goals and resolving these problems? And I'm going to say she's made some progress so far. What are my recommendations? And I'm going to say that new short-term goals have been set up today. We met with her in a face-to-face meeting. And for right now, I'm going to skip, we've already done the snaps now. I'm not going to do that again. And I'm going to stay out of this area. And I'm just ready now to come over here and use a custom button for anything that I'd like to add into her updated status area. When I'm ready, I can come over here to compile the note. Once again, if I wanted to add a brand new problem that's not on the list, I could do it from right here. I'm going to preview all of her problems here, the ones that were updated today, the prior ones that we didn't update, and roll this into a brand new note. Here it is. I'm going to save this as a progress note. I'm not going to set up a reminder. And now I have my treatment plan. If I want to come in here once again and put down that this is a subsequent treatment plan, to individualize that, I can certainly do that. Click continue. Subsequent treatment plan. Here's the diagnosis. Diagnoses have come forward: depression and diabetes, the current medications, the problems. Diabetes is showing first. Long-term goal, short-term goal, the status of that problem. Depressed mood with the long-term goal, the short-term goals, including the areas that we have updated. You can see here, for example, I'm going to make this bold so you guys can see it just a little bit more easily. You can see that the target date and the completion date are now showing in the subsequent treatment plan, and the status has been marked as effective. This is from our first note. You can see that it would have the prior date when you did this SNAP scale. We can come down here and we've updated the status for today. I could make an argument for erasing this if I wanted to as well. It's an individual workflow that you guys can decide on. We didn't make any changes with the barriers or strengths. I'm just going to go ahead and erase this information right here. And I'm going to electronically sign it. Now, I want to just take one more moment to show you, especially if you're working in an inpatient setting and you're scribing the whole note for every member of the team. A common question that we get is, how do I let my other team members know that I have scribed for them in this treatment plan, but they need to co-sign this? Remember, our treatment plan will accept multiple electronic signatures. We have a really nice way of doing this. If you're not familiar with it, it's super easy. From this note area here, just come over here and click internal message. We're going to send it out to Liz RN. I'm going to copy it to some other people that participated in this. Liz MD, Minnie Mouse, Rachel Morris, whoever. Click done. Notice it puts the note right in here. I can put a high priority on this, and I'm going to say treatment plan. Review and co-sign. And I'm going to send this. It's going to go out in real time. I'm going to take you right over here to the chart room. I'm going right into my messaging center that's been delivered to me and to everybody that I sent it to. Sent to Liz RN, review and treatment plan, review and co-sign. The really great thing about this is when you open up this message, you can click right on Anna's icon and be taken right back into her chart base. Now there's been one signature. You'd want to go to the compiled note. You, of course, would review it to make sure that what's scribed in there under your name is correct. If you agree with the way the scribe has set this up, then you could add your electronic signature as well. Each person that had worked on this note could come in. I'll just put a third e-signature on here. And now you'd have a record of each person that's electronically signed. It would be in 3 different names.